Welcome to The Explainer, where we dig into the original source material to make sense of complex topics. Today, we're unpacking the Affordable Care Act. You probably know it as Obamacare, and what the data tells us would happen if it were ever repealed. So let's just start with this question, because for millions and millions of people, this isn't just a thought experiment. It's a very real possibility that gets right to the heart of the whole debate. To really understand why, we've got to look at a core piece of how the law works right now, and that's the financial safety net it creates. This is the whole mechanism that makes insurance affordable in the first place for so many. Okay, so at its core, the ACA provides what are called subsidies. You can think of it as direct financial help from the federal government. The whole point is to bring down that monthly insurance bill for individuals and families who are below a certain income level.
And we're not talking about a little bit of money here. The scale of this program is, well, it's massive. Every single year, the U.S. government puts over $50 billion into these subsidies to keep those monthly payments manageable. And that $50 billion? That's the number right at the center of this whole conversation. So what happens if that $50 billion safety net just disappears? This is where we see the most immediate, the most personal impact of a potential repeal. Let's really look at what the numbers say.
And here it is, plain and simple. Right now, the average person getting help pays about $74 a month for their premium. Without that subsidy, estimates show that same premium would shoot up to $159. We're talking more than double, literally overnight.
And of course, that kind of financial shock has a very real, very human consequence. All this uncertainty creates a ton of anxiety. You have families who absolutely depend on this help for their health care, and they're left asking a really simple but incredibly stressful question. What are we supposed to do?
But the subsidies aren't the only major piece of this puzzle. The ACA also brought in a pretty controversial rule that was designed to get more people, especially young healthy people, into the insurance market.
You've probably heard this called the individual mandate. The way it works now is you're required to have health insurance or else you pay a penalty to the government. If the law were repealed, this requirement, and that penalty along with it, would almost certainly go away. Now let's zoom out a bit, because the impact goes way beyond just the subsidies and the penalties. A full repeal of the law would set off a much wider ripple effect across the entire healthcare system. It's a whole different ballgame.
So what would that look like? Well, for starters, and this is a big one, a full repeal would probably mean the end of protections for people with pre-existing conditions. That means insurance companies could go back to denying you coverage or charging you way more if you have a long-term health issue like diabetes or asthma.
And then, think about the millions of people who got health insurance for the very first time either through the expansion of Medicaid or through the new marketplaces. A lot of those people could find themselves completely uninsured all over again.
Even one of the most popular parts of the law would be on a chopping block. That rule that lets young adults stay on their parents' health plan until they turn 26, yeah, that would be gone.
And on top of all that, we'd likely see the return of lifetime and annual limits on coverage. Before the ACA, insurance companies could actually put a cap on how much they'd pay for your medical care over your lifetime. A repeal could bring those caps right back, putting anyone with a serious illness in a really tough financial spot.
So what this really leaves us with are two very different potential futures. One is about that immediate financial shock, while the other is a complete structural teardown of the healthcare system as we know it.
And this chart really lays it out, side by side. On the one hand, you have the direct hit to people's wallets if the subsidies go away. But on the other hand, a full repeal dismantles the entire framework. It changes everything from who can even get insurance to how much care they're allowed to receive.
Ultimately, when you weigh all these different impacts, it forces us all to wrestle with a much bigger question, one that's really at the foundation of this entire debate. What is the role of healthcare in our society? Is it something we're each responsible for getting on our own, like a product? Or is it more of a public good, something we have a collective responsibility to make sure everyone has access to?